as well. My name is Philip Wandrico. I am the Assistant Product Director for SOAR 2.0. I am joined here today with other members of the Grants Administration team, our regional presenter for today, and the SARDI team at Wright State University. Today we'll be covering the Northwest region, and the project lead assigned to this region is Ashley Murphy. She's our project coordinator. And we're just going to get into some general housekeeping rules before we get started. This meeting is being recorded and may be posted to our Ohio Moss website. Please ensure that you mute your computer and or phone if you're tuning in by phone, and turn off your camera throughout the duration of the call, please. If you have any questions, please send those questions into the chat box. Our chat box is moderated by one of our staff members here at the Grants Administration Bureau. They'll be answering questions on the spot or giving links to the websites and other things that we might have in the presentation, such as the one below, into the chat box as well. And then any questions that aren't answered in the chat box will be discussed at the end of today's meeting. The Ohio Moss website for federal grant projects contains FAQs and additional information about these projects to use the following link. So that is our link directly to the Apply for Funding page and a general posting of the grants and items that are available at Ohio Moss, such as discretionary grants, SOAR grants, block grants, and then the Table B document. And just a reminder for those that are just coming in, please mute your microphones and turn off your cameras. And then next slide, please. We are having our quarterly collaborative call survey directly after this meeting. If you could please do the survey, we greatly appreciate it. This survey gives us vital information about how we performed during the call, what information that we provided you that you found informative or helpful in your work in the field, and gives us ideas on how we can go forward in making these quarterly collaborative calls more informative for you. There's the survey. It's going to be posted in the chat box as well. Thank you. Just an overview of our grants administration team. Listed here are the various staff, their roles, and if they work on a particular grant or particular region, they are listed here. You'll see Ashley Murphy, the project coordinator, who runs the Northwest and Twin Valley regions of the SOAR 2.0 grant. And with that, I have the honor to introduce Dr. Valerie Alloy, who is our Chief of the Bureau of Grants Administration. And Dr. Alloy would like to give some opening and welcome remarks. Dr. Alloy?
Well, thank you so much, Philip, and welcome everyone on the call. It's always a pleasure to get a few minutes of your time. We really want to just say on behalf of the department how much gratitude we have for the partnership and the tremendous work that we do in these SUD area and the opioid use disorder area. We also do this work in a epidemic status under the umbrella of a international pandemic. So we truly recognize the difficulty and the challenges trying to save lives and move people into recovery under such unusual circumstances. So with that, we want to say we have our gratitude to all of our partners, as well as our understanding of the grace that it takes that we want to extend you and each other and one another trying to work under these conditions. So we absolutely understand it in terms of slow startup and staffing concerns and client concerns. And so we are very mindful of that as we continue to do this work. Having said that, though, we do have a responsibility. Ohio still ranks as one of the 10 top states in the nation for opioid deaths. And so we have a lot of work to do. And in the coming weeks and months, not only is it important that in calls like this, we really listen both with our ears and our hearts to understand what is working, what is proving to be some of the tools in Ohio's toolbox, what are the strategies that should be sustained, and then what are the strategies that are proving to be less effective that we may have tried that are not getting us where we need to be. The department's job is to listen to that, again, with a laser focus so that we know the types of future funds that we need to procure to continue to support you all and the citizens of Ohio in achieving a long and healthy life. So I have the opportunity to do the opening remark. The rest of the call is where the work really gets done, to hear from all of you and understand and join in our awareness and sharpening our focus on what needs to happen next. So with that, I want to thank everyone on the call for giving us time today. On behalf of the Department of Mental Health and Addiction Services, we thank you for your service.
Thank you, Dr. Alloy. So moving on to SOAR 2.0. Thank you all for your hard work in making SOAR 2.0 year one successful. We effectively call year one of SOAR 2.0 here at the department SOAR 2.1, and in respective the SOAR year two is called 2.2. So you might hear us use 2.1 and 2.2, referring to the first and second year of SOAR throughout this presentation, as well as with documents and correspondences going forward. SOAR 2.1 ended on September 29, 2021, and 2.2 began the next day on September 30th, 2021, and will run through September 29th of this year, 2022. Next slide, please. The grant closeout process for 2.1 proved to be successful, and we plan to continue this process going forward. In the fall, at the end of the grant period, we will disseminate reminder notices and information regarding the closeout process for the current year then. In regards to carryover, the department submitted a formal carryover request to SAMHSA and is currently awaiting for processing. Our hope is that we'll learn more information about the request in the next coming weeks or months. So we'll keep you updated when we get that information. As a reminder, any carryover requests that we do receive are not returned to the original awardee. That Ohio Mas senior leadership does have the final decision on how those carryover funds are awarded. In regards to mid-year reporting, our mid-year reports are due in March. The department will be sending out narrative forms to complete soon. Look out for these sometime this week or early next week to get these forms. These forms will have fillable information regarding your projects, and it'll help us with our reporting to SAMHSA. Please use a template, and if you have any questions, feel free to reach out to your project lead in regards to completing that process. Next slide, please. Just a little update on SOAR 2.0 funding statements. This is a reminder for all print, media, and training materials that the following disclaimers should be put into some small print somewhere on the item that you are disseminating. Please reach out to your project leads for copies of these statements, as well as official logos from Ohio Mas and SAMHSA. For those that are tuning in via phone, I'm going to go ahead and read these statements so you can hear them. This publication or program, you can choose what word, was made possible by grant, and I'm going to just you insert the grant number there from SAMHSA. Its official contents are the sole responsibility of the author and do not necessarily represent the official views of SAMHSA. And the other example is funding for this training was made possible in part by the Ohio State Opioid Response, SOAR, and it gives the grant number again from SAMHSA. The views expressed in the written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of the trade names, commercial practices, or organizations imply endorsement by the U.S. government. If you have any questions about these funding statements, again, please reach out to your project leads, or you can place them in the chat box and we will be glad to discuss them with you. Just some more updates on the website. For those that were here in the previous quarterly collaborative call in October, we discussed that we were launching a new website. The new website is up and running. You will find information such as the community investment guidebook. We are working on updating the guidebook and putting the newer version for 2.2 on the website shortly for everyone to access. You'll have information updates there, regularly updated FAQs. So if we get a lot of good questions and stuff in our chat box today or verbally through the meeting, we'll update those and put them on the website as well. Reporting requirements and links to the Wright State University SARDI program for our data collection. Calendar of events such as the calls that we're on now and or GIPR training, and list of allowable costs. Since the website is new, we do have a new direct link, which is located there directly to the state opioid response area. As a reminder, if you do have any questions, please feel free to use the chat box and we'll get to them soon. And with SOAR 1.0 NCE, this grant also officially ended on September 29th, 2021. We want to thank everyone for their amazing and hard work that was completed under this grant. We were so impressed by the amount of lives in Ohio that were touched by each of these projects. The Bureau completed a 3-year end of grant report and submitted it to SAMHSA in December. To date, we are expecting to send back less than $1.9 million to the federal government. And that's total for the whole 3 years of the SOAR 1.0 or SOAR Prime projects. This is an amazing feat, and each and every one of you should be very proud of this accomplishment, and as are we, and for the work that was provided to our fellow Ohioans. With that, I would like to turn over the presentation to Chris Sealski, the Assistant Chief of the Bureau of Grants Administration, to talk about Mapadoa. Christine?
Good morning. Thank you, Philip.
Thank you.
First of all, I want to say good morning, and it's really nice to see all of you on the call this morning. And first, I want to thank all of the boards and the providers who participated in the Mapadoa grant. This important work has made a big difference across the state of Ohio for Ohioans, and it represents your dedication and hard work in serving these Ohioans with OUD. So the Mapadoa grant did close on 9/29/21. There is very little funding that's going back to SAMHSA, which we are grateful to you for spending your awards. And there is no further funding currently posted by SAMHSA for Mapadoa. So it is closed, and if you have any questions about Mapadoa, please feel free to reach out to me. But thank you again for your hard work on that grant. So now I want to turn our attention to the RSP grant. This is the Regular Services Grant, which was a FEMA-SAMHSA joint effort to help reduce COVID stress in the state of Ohio. And it ended on October 24th of 21. And as you'll see in the next slide, that we have data that shows that the grant very much outperformed its expectations. When we wrote the initial application for the grant, we told SAMHSA that we estimated we would help about 47,000 individuals. However, you can see from this slide that 651,159 individuals were helped. They were helped because of the hard work of the boards, their agencies, their paraprofessional staff. All the credit goes to all of you for this hard work. The big difference was made in the lives of the individuals who were helped with this grant. This comes through very clearly with the emotional impact stories, which help us connect the data to the actual work that's being done in the field. The stories are heartwarming. They show that the individuals did receive the resources that were requested, the things that helped them to deal with the pandemic, whether it was food insecurity or help in getting an appointment for testing or a vaccination. There were all kinds of different caveats for help, and no two people really needed exactly the same thing. We I want to thank you again for your hard work on this. I think that it shows how hard the paraprofessionals worked in the field. Not only did they do the required outreach and referral, they went back and did more outreach to make sure people actually were able to use the referrals and to reach the referrals. And if they weren't, they helped them to reach the referrals. So thank you again to everyone who participated in this grant. It was very successful and will be featured in a future SAMHSA publication as an article for Ohio. So at this time, I want to go ahead and turn the floor back over to Philip. Thank you, Philip.
Thank you, Christine, for those updates for RSP and Mapadoa. Now I'd like to introduce Ashley Murphy, our project coordinator for SOAR 2.0, who is also the project lead for the Northwest region. Ashley?
Thank you, Philip. Good morning, everyone. As the other presenters have said, I just wanted to take a moment to say thank you for joining today's call. As mentioned, my name is Ashley Murphy, and I am the new Northwest Projects lead. And I'm really looking forward to learning more about your SOAR projects as time progresses. Next slide, please. For today's regional highlights, I would like to welcome the Lima Umadop. For today's presenters, we have CEO Myrtle Boykin-Lighton and Marcel King. Myrtle and Marcel, you may unmute yourself and turn on your camera at this time.
Good morning, everyone. I don't have a camera available. I don't know if Mr. King does.
Good morning.
So I'll just kind of briefly start and say, we just want to say thank you for the opportunity that this grant allowed for us, and the work that we were able to do with the proposal and with the SOAR. We met the need by decreasing stigma. It opened up a lot of dialogue in the community through some of our advances to reach the target population. We were able to provide avenue where we can address the people that we wanted to serve right where they were. We were able to utilize media as a means to get the word out. And, you know, our specific targets were African American and Hispanic Americans. And we did the Northwest Quadrant and around Wauseon, Ohio for the Spanish and Latino community, and realizing that Wauseon had the 5th largest population of Hispanic in Ohio outside of the Cleveland area. And so we were able to kind of find ways to meet the target population, to talk about addiction, to provide awareness to families. And we had the town hall meetings. We had our phone line. We had a Spanish speaking phone line, which was really instrumental. We put out Spanish speaking brochures and literature. In Allen County, we did our town hall meetings, and I think the biggest thing was tying in with community partners and faith-based partners, and reaching out to them and giving them an avenue to provide awareness to their communities, and, you know, doing this all in the midst of the pandemic. It was just surreal, I guess is what I want to say. But those town hall meetings where we talked about the issues, and we had the speakers that come in, and we had the open venue for people in the community that, you know, wanted to ask questions or share information. It was just really, really, really went well. We were able to just touch a lot of people just by the trainings. We even the SOAR interviews, it just gave us an avenue to not only touch people and provide awareness, but to give them that, I want to say, comfortable walkway into those that said, this has just got to stop and I need recovery, you know, or to have that safe place where they can call and talk to somebody who, you know, the pandemic allowed people that probably wouldn't step up for traditional treatment who did so. So it just provided us a platform and an avenue to touch people in ways that financially we could have never. And so we're just so grateful for the ability to do the work. We're excited to continue in this project. And as you can see, it's in the morning. I'm a morning person and I rattle. But at that point, I'll just, if Mr. King wants to add something, because I know we don't have very much time, I'll just say thank you and let him speak.
No, Ms. Lighton, you covered everything. We were able to also disseminate information, and along with disseminating information, we found also that the information for those that may have had some issues that needed family support, suffering from mental health, the Ohio Care Line talking points, which disseminated with the information as well. So that came in very handy.
All right, thank you both. Dr. Alloy, do you have a question?
Thank you, Ashley and Ms. Myrtle and Mr. King. Oh my goodness, I do have a question. Thank you. Based upon your experience, and I love the way you put it, kind of the on-ramp, the entranceway, is this the type of community conversation that you feel should continue to happen for the foreseeable future?
I personally loved it. We had a candid talk, and we had, I just never forget, in Allen County, we had a firefighter who is not only a firefighter, but he was a very strong community advocate. And just some of the things that he was able to voice so that other community members could hear was just astronomical. And then having family members to be in a place where they could ask questions and not feel like it was so tied to what was going on in their family, but able to ask the question and get the answer and get the help that they need. So yes, I think it's a very, very strong, positive way to bring awareness, community support, and community collaboration.
Thank you so much. That was what I was feeling from what you said, awareness, collaboration, and really engagement, knowing how the barriers are for so many across different reasons, and hearing that this provided an opportunity that people said, I need recovery. So then that was the gateway to engagement. Thank you so much for taking my question and carry on. And thank you for the work.
Thank you so much.
Yeah.
All right, well, as Dr. Alloy mentioned, thank you both for sharing your highlights on your SOAR project, and thank you for the work that you're doing in the Northwest region to reach the minority populations. At this time, if anyone else has any other questions for today's presenters, or if you would like to share any of your highlights or successes, maybe something along the similar lines of what was shared today, please feel free to unmute yourself and turn on your video.
While we're waiting, Ashley, for other people to raise their hands or turn on their video, I was just thinking with the last presenters, what a great story. It would be so nice to have an impact story sent in that we could share with SAMHSA. We really like to have those impact stories from all of our providers regarding the work that they're doing and how it is impacting individuals on the ground. So if everyone could think about that and send them into their project leads, that would be perfect. Thank you, Ashley.
Yes, thank you, Chris. Great point. Impact stories are definitely a way for us to learn more about your projects and see the work that you're doing. So thank you for that addition. While maybe you're thinking about sharing, in the past few weeks in working with the Northwest region, I've really learned a lot with conversing with you, whether it's been email, phone call, Teams meetings. One thing I found particularly amazing about this region is truly the implementation of the continuum of care. So there's a lot of projects that are addressing prevention-based services and engagement, but then there are also several projects that are looking at direct service throughout the various levels of care and targeting various different populations. So as was shared today, we have projects targeting racial and ethnic minorities. There are also quite a few projects in this region targeting individuals involved with the criminal justice system. Then there's also communities in this region that are rural and the services are targeted towards that. So before I pass the call back to Philip, if there are no further questions or statements, I just wanted to commend your efforts and say thank you for all of the work that you're doing to ensure that Ohioans are receiving access to care.
Thank you, Ashley. Thank you, Lima Umadop, for sharing today, and thank you for the questions. Moving forward, I would like to introduce the SARDI team at Wright State University to give us an update regarding our data collection and evaluation for the SOAR 2.0 grant. So if the SARDI team would like to come on and give their presentation, they're welcome to do so.
Thank you, Philip. Good morning, everyone. My name is Brady Wilson. I'm joined by my colleague Jenna Killian, Angela Zaragoza, and as Philip said, we just wanted to give a quick evaluation about reporting, numbers, and training. So if we can move to the next slide, please, we'll get started. So at the top here, you can see the number of intake interviews that have been completed for the project to date. That number is 13,083. Below that, you will see our number of intake interviews that have been completed for this SOAR year 2. So far, we have 3,327 interviews completed. This is 37% of the yearly goal of 9,000. So even though we are only in the first quarter, we are already a third of our way to our intake goal. So absolutely fantastic job, all of you, for that. Breaking that 3,327 number down by program type, local board had the most intake interviews entered with 2,829 at 85%, followed by community organization with 6.1%, innovation with 6.4%, and moms with 2%. At the very end, we have ODJFS and Ohio Start at 15 with 0.5%. Next slide, please. Moving from intake to follow-up and discharge interviews, we so far have 3,366 follow-up interviews, both completed and administrative, into the iPortal for the project to date. Of those follow-up, 2,207 were full interviews, so 2/3 of those, with the remaining 1/3 being follow-ups that were administrative. The follow-up rate for those in window is 27%, so about 1/5. For discharge interviews, we have 1,539 discharge record, both completed administrative project to date. Next slide, please. I also just kind of want to take the time to mention some of the changes we made to the biweekly report. The board may have already seen this, but I just want to go over it again, just in case there are any additional questions. So the way to read this is that the very first column is, intakes for the year 1, followed by the second column, which is intakes year 2, but that is split up by those completed within the last 2 weeks, as these are biweekly reports, followed by total interviews completed for the second year, then service-only interviews, and then the last number of that column is a summation of the previous 3. We've also added a follow-up project to date. This is both, the first part is the completed within the last 2 weeks, and the second is a rate. This rate is calculated by the number of follow-ups that have been completed project to date, divided by the number of follow-ups that have entered the eligibility window from the beginning of the grant. And finally, we have also added a discharge column with both administrative and completed discharges. With that being said, if you have any questions over the report or any of the number just given, we have our email posted at the end, as well as on Ohio Mouse's website. Feel free to reach out if you have any additional questions. With that, I will hand it over to Jenna to talk about training.
Thank you so much, Brady. Hi, everyone. As Brady said, my name is Jenna Killian, and I am also a research assistant here on the SARDI team, and I'm going to talk today a little bit about some training updates. So as you can see on the screen, these are the numbers of the amount of people we have trained within the last 3 months. We have trained a total of 120 people, with 102 of those being full SOAR 2.0 trainings, 15 of those being update and refresher trainings, and 3 of those being Q&A. Now, the Q&A number may seem a little small to you, but this is because most of our Q&As have gone into a one-on-one format. We are doing Zoom Q&As and phone calls quite often on a fairly frequent basis with our providers. And so instead of doing more of the group Q&As, our Q&As have turned into more of an individualized basis. Just a reminder that all new hires or all new GEPRA collectors at your agency must be trained through the SAMHSA required training, and they must attend a full SOAR 2.0 training. Within the past couple weeks, even, we have had a lot of people trying to gain access to the iPortal or requesting information about trainings, slides and things of that nature that have not taken the training. And this is a required training, so just a reminder that your new staff has to attend the full training before they are allowed to complete GEPRAs. Next slide, please. So here's a look at our schedule for the next 2 months through March. Per usual, we have some full SOAR 2 trainings, we have our SOAR 2 update and refresher, and we have some Q&A sessions. And as usual, to sign up for any of these trainings, you're just going to go ahead and visit our website, which we will put in the chat box for you. Next slide, please. So in addition to our normal training schedule, we are also going to have some mandatory trainings. So these have come about because we have had a lot of questions lately regarding our follow-up and discharge interviews. As Brady mentioned in the previous slides, our numbers for those are relatively low. So we thought we might do a mandatory training to really just put some reminders out and come up with some strategies for really completing these follow-up and discharge interviews. We've also had some questions about the locator form and the consent form, and so that will be included in the training as well to make sure everybody knows where the consent form is and making sure we are filling out the locator form properly so that the clients are receiving their gift card incentives. These trainings will take place in February and March. They are going to be on Tuesdays and Thursdays, and you only need to select one of these trainings. It's not a series, you just need to pick one to go to. But a reminder that this is a mandatory training, so please make sure that you and your staff are making it to one of these trainings. And the training is, as I said, 1 hour in length. And then to register for these trainings, you, as you would any other training, are going to visit our SARDI website that we're going to put in the chat box, and that will be up to register for shortly. Next slide, please. And then just to recap some of the technical assistance highlights that we have been working on over the past couple months, as I mentioned, we've been really working with people to complete the follow-up and discharge interviews and try to strategize and make sure that those are getting accomplished. We have been working with people on deleting interviews where they need deleted. This is a very laborious task, and so we've been working with these providers that have needed interviews deleted to make sure that this does not happen again in the future, and strategizing ways that we can prevent duplicate interviews being entered and things of that nature. We've also been going over the consent and the locator form, as I mentioned, and making sure those are filled out properly and we know where to find those. I'm working with providers to access the SOAR 2 iPortal, and then as Brady mentioned, we added discharge interview data to the reports. Next slide, please. Here's our email and our website. If you ever need anything, please don't hesitate to reach out to us. If you have a question about anything GEPRA or reporting related or a reporting request, we are more than happy to help you. So yeah, that's our email if you ever want want to reach out to us. And again, thank you for the great work that you're doing. And so now I'm going to turn it back over to Philip.
Thank you, Jenna and Brady, for that update regarding our data collection and evaluation. Just another reminder about our collaborative survey that is in our chat box. If you can complete that, like I said before, it does provide us with vital information about these meetings and how we can better serve you and the community with the content of these meetings going forward. It should only take a few minutes of your time, only a couple quick questions, and we do really appreciate it. So thank you for your time with that. And then our last slide here, just a reminder that we are on social media. We do post news and successes and things that are going on within the department on these different things. There's the website link. And with that, that does bring us to the end of our presentation. So I will open up the floor for any questions, any comments, any shares regarding any successes in your projects, maybe some challenges and how you're overcoming those challenges, any questions for the presenters as well. Feel free to either unmute yourself and turn on your camera or type in the questions into the chat box. We really do want to hear from everyone and make this a collaborative meeting. So Jennifer had asked about the dates of the mandatory training. Can we roll back the slides a couple bit, Valerie, please? Let's see here. So the first training is going to be February 22nd, then March 3rd, March 8th, March 17th, and March 22nd. I did speak with the SARDI team this morning. Those mandatory trainings are not yet listed on their website, but they will be posted soon. So keep an eye out for those when they are posted. And you can go ahead and register for them then. Angela from the SARDI team did also respond into the chat box as well. Good question. Any other questions? Okay. Well, as people are typing in the chat box, just a reminder that that our next quarterly collaborative call will be sometime in April. We will send out notices for that meeting within the month of March. The same time those mid-year reports are due. So again, we thank you all for your time. If there are no more questions, we will go ahead and adjourn. And I hope you all have a wonderful rest of your day. You're staying warm. And please reach out to your project leads or myself if you have any other questions regarding today's meeting and things you learned. Thank you. Have a wonderful day.